Recently, the emergency medicine program at the University of Toledo was involved with a disaster exercise. The purposes of the exercise was to evaluate an alternative care site on campus should the emergency department become incapacitated due to violent storm and a resulting tornado. The purposes of this video is to present several vignettes which are meant to illustrate concepts with regards to disaster medicine for the emergency physician and the emergency medicine resident. Apart from that, the second objective with this video is to demonstrate the versatility of a specific video camera that is versatile, easily transportable, and lends itself to not only documenting an exercise or an actual disaster, but also has applicability with regards to education, as you will see.
Hey, ortho just claps and there's possible death, okay?
The incident commander has now received word that the tornado has destroyed part of the orthopedics building adjacent to Dowling Hall. There are casualties. He's receiving word, and now he has to make a decision as to how to attend to those victims. Here is the arrival of the triage team coming to Dowling Hall to take care of the victims. I want you to focus on the triage team, specifically the physician who's in the process of evaluating each of these patients. Here is an opportunity for you to consider how it's being managed and if you would do anything differently. Please note that with all the chaos and noise that's going on, that the team, specifically the physician, is concentrating on his task at hand and is not being swayed by the confusion. Now, in this sequence where this team is coming to do the triaging of the secondary disaster site, I'm sure you appreciate the moaning and the groaning of the gentleman there with his injuries. I don't know if you agree with me or not, but if I were involved with the triaging of these patients, just the fact that this person is moaning and groaning and asking for assistance tells me a number of things. That essentially his airway and breathing are adequate, and possibly even to a large extent his circulation, since he is showing evidence of thinking and acting appropriately. The man has a problem, the man has pain, and he's asking for help. So essentially, my attention will be directed to those people who are not manifesting anything that I can tangibly sense. He, on the other hand, I can hear. So in my own head, I've already triaged him to possibly a yellow, maybe even a green. The question is, do you agree? And if not, why?
How you doing? Your leg hurt you? You're going to be all right. You can hang in there, okay? We'll get you the triage as soon as we can. I got no meds here. I'm sorry. We'll get you as soon as we can. Next patient.
What you'll be seeing now is a teaching moment. The situation is this. We have one physician and we have two patients. When he started escorting these patients to Collier, one of them, a pediatric patient, stopped breathing. The other patient, who's complaining of difficulty breathing, is still awake, alive, and is at the scene also. How would you manage this situation?
So, yeah, go ahead. So you got a situation, okay, you're between the devil and deep blue sea again. She has no pulse, she has no respirations, you're by yourself, you got a radio, you made your report, right? Mm-hmm. You did that already. You have a patient over here who's seeing all this going on, okay, and she's asthmatic.
My blood pressure's going up.
And her blood pressure's going up. And
Where are we going to lie down to?
Now, if you were faced with this situation, what are you going to do? Instinctively, you went, you were going to give mouth to mouth.
Well, I'm alone, and this one's
You're alone.
pulseless. Saddam's black, so I'll treat this patient.
Okay, and I'm not so sure if I would call her black, okay? Because even though she's 10 years old, she's a pediatric patient, she stopped breathing, you might be able to get it back with the, what do you call it, with giving her some breath.
I have no equipment.
You have no, you can give mouth to mouth and you can do CPR.
All right. Well, I guess I would still be doing that until this person starts to tank.
Yeah, no, that's right. Yeah, exactly. And then again, because it's controversial. If you were by yourself and you had all those patients over there, okay, it's legitimate probably to say that this one's now is black. Mm-hmm. Give her some breaths, give her some pressure, see if she comes back. She doesn't come back, you say she's black and move on, okay? And take her with you in some fashion, okay? Because she's alive, she's dead, all right? In a situation like this...
The 10-year-old, I could just carry this kid.
Yeah, you can do that, yeah. The other situation is that if you have a lot of people around, you have other physicians and all that sort of stuff, okay? You can afford to do what you would normally do on a day-to-day basis,
yeah.
which
Let
is the
alone.
CPR and all that sort of business. Because you made the call, you called 911, you called for help, and you're doing that for a period of time, okay?
Okay.
So I would prefer you doing that for a 10-year-old in this circumstance,
sure, of course.
since those people have already been moved out.
Mhm.
All you have now are dead people there.
Yeah.
Right. So they've all been moved, they're dead, they'll stay dead. You've got to worry about her, you got to worry about her.
Right.
I give her some time with doing CPR, probably won't go overall, and you make your call and see, who responds.
All right.
Okay.
Now, with this teaching moment number 1, you may agree or disagree with how these 2 patients were going to be managed at the time. And that's not really important. What's important is that you need to make a decision. You need to act upon that decision. You can't waffle during these kinds of situations, because waffling, debating with yourself, takes time, and time can cost lives. But I do want to bring up the point that whatever decision you make can have significant consequences mentally speaking. Let's say the physician or the nurse or the PA or the nurse practitioner has decided not to resuscitate that pediatric patient, but to escort the other patient for definitive care. That may be good disaster management and good resource planning. However, keep in mind that there may be some mental health consequences for that particular person, because they're doing something that they would not normally do in traditional medical management. Similarly, there's a mental health issue for that second victim that's there seeing what is occurring. So always keep in mind that besides the medical care of both responder and victim, there is also the mental health aspects that always need to be addressed. Now we come to a second teaching moment. The scenario is that this team is transporting 2 patients from the Dowling Hole disaster site to the triage area at Collier. They're in between the 2 venues. As the transportation continues, one of the patients suddenly stops breathing. You have your team, you have your communications. How would you handle the situation?
Okay, fine. We're gonna get her off.
In this second teaching moment, you may agree or disagree with regards to how this patient that stopped breathing and had no pulse was being managed, which is fine. And I think a lot of that management decision will be based upon how deep your resources are during this disaster. If you have sufficient personnel managing the incident, you may decide that you could afford time to perform CPR on this particular patient. However, if your team that is doing the transportation is going to be vital to the performance of the treatment at the primary site, it also is reasonable to declare that patient that stopped breathing and has lost her pulse to be declared dead, to tag her black, and to move on to where live victims are that need your care immediately. But here again, you need to make that decision. You need to make that decision quickly, and then you're going to have to live with that decision. So here again, a mental health issue will need to be addressed after the situation has been resolved.
So that's what you got to do. You got to portray, a sea of calmness, okay, into this turmoil that's around the world. So you got other patients over there. They say they need a doctor to put a chest tube in, or so they need a doctor to do this. They need a doctor to intubate a baby, okay, and you're the only doctor around, okay, 3 o'clock in the morning, okay. You got this thing going on over here. No, you're not a thing, but you got this going on over here.
Okay.
So what are you going to do?
Probably go down that way.
Okay, so what are you going to tell people over here?
We have nurses here. If she goes pulseless, you guys, CPR.
Right.
And keep bagging her and helps on the way.
Right, okay, so yeah, you're gonna leave her and go, that's fine. The thing is though,
Here's
it's
tag.
always good to have
You need
somebody
tag?
go back just to double check. It's always
Yeah.
good to make sure that area is really clear.
Right.
That was the last patient, but we don't know.
Out of it.
She's out of it.
The after action report, or the hot wash that was held immediately after the exercise, revealed that by and large the exercise went well and people learned a great deal. This was specifically noted among the various healthcare students that took part in the exercise. This included nursing students, PA students, medical students, and pharmacy students. They enjoyed the interdisciplinary aspects of the training, and they also enjoyed the education that they received from the emergency medicine residents.